Hi, I'm Sharon. I work as a consultant psychologist at Mysterious Minds. So, to start off, we'll talk a little bit about the most romanticized mental illness of our generation, which is depression. ഇതൊരു മൂഡ് ഡിസോർഡർ ആണ്. Like a lot of mood disorders, it does start teenage ഏജിലും it can also manifest in adulthood. So ഇതിൻ്റെ സിംറ്റംസ് നമുക്ക് എങ്ങനെ മനസ്സിലാവണമെന്ന് വെച്ചാൽ മെയിൻലി ദർ ബി ലോ മൂഡ്, pervasive sadness. There will be complaints about, എനിക്ക് ലൈഫിൽ നിന്നൊന്നും കിട്ടുന്നില്ല, ലൈഫ് ഇസ് പോയിന്റ്ലെസ്, ഐ ഡോണ്ട് ഫീൽ വർത്തി ഇനഫ്. So a lot of self-degrading statements. That is one major cognitive aspect of how depression is manifested. അതല്ലാണ്ട് we can also see physical symptoms like lack of sleep maybe, കഴിക്കുന്ന ഫുഡ് കുറച്ചു, maybe you used to enjoy doing something a lot and now you don't do that. You don't want to go talk, you don't want to go play. So mainly children, we see it through their physical activities. They were involved in studies നേരത്തെ. ഇപ്പോൾ they're maybe sort of scaling back or they're falling a little bit in their grade. Again, feelings of worthlessness, decisions ഉണ്ടാക്കാൻ വരുമ്പോൾ അതിന് ബുദ്ധിമുട്ടാണ്. If you ask an opinion, they don't have an opinion at all. So when we see this as a consistent pattern for a period of time, then we can probably, with the help of few assessments, we can say depression ആണെന്ന്. But if you are feeling these symptoms for maybe a day or two, that does not qualify, or we cannot diagnose as saying that you have depression. And one major factor that we can look into is there are two types primarily. There is atypical depression and typical depression. ഇപ്പോൾ നേരത്തെ പറഞ്ഞ symptoms of low mood, appetite പോയി, weight gain ഉണ്ട്, pleasurable activities ഇല്ല, negative thinking, ഇതൊക്കെയാണ് typical depression symptoms നമ്മൾ പറയുന്നത്. And this is what we usually look out for when we try to diagnose. But there is also atypical depression. So ഇവിടെ വരുമ്പോൾ you might for a certain amount of time you might be happy. Responding to the environment, you will have pleasurable moments. പക്ഷെ അതൊഴിച്ച് ബാക്കി എല്ലാ സമയത്തും you will be a little sad. You will be thinking about negative thoughts, suicidal thoughts, low self-esteem, low self-worth, അങ്ങനത്തെ thoughts ആയിരിക്കും. But for a momentary period of time, you will feel happy. So that is how we try to see typical depression and atypical depression. And also in atypical depression, there is more sleeping, more eating compared to a typical depression. So ഇപ്പം നമ്മൾ പറഞ്ഞ symptoms ഒക്കെ, all of us will face this in a day or two. When certain stressors come, we might feel sad. Our self-esteem will go low. There will be some sort of suicidal ideation. അല്ലെങ്കിൽ few days we might not want to eat a lot. So none of these symptoms, when we feel for a day or two, we can diagnose saying, okay, depression ഉണ്ടെന്ന്. But rather, minimum of 2 weeks, we need a pervasive low mood, suicidal ideations ഉണ്ടാവും ചിലപ്പോൾ, low self-esteem thoughts ഉണ്ടായിരിക്കും. You cannot get yourself out to do things. Pleasurable activities will be low. So അങ്ങനെ once there are a certain set of symptoms for a period of time, first 2 weeks, apurana we diagnose it as depression. And depending on the number of symptoms, depending on the severity, we classify it to mild, moderate and severe. So because it is a very romanticized and a very in our generation mental illness, it is very common for us to use the language and say, okay, I'm depressed, but we should inhibit ourselves from using that kind of term. But we can rather say, okay, sangada vandalini, I'm sad, I'm feeling a little gloomy. Because depression is a diagnosis, it is serious, and it is not equivalent to being just sad or just mood illa. Adalla depression. So that is something that we can definitely look into when we want to see if somebody has depression or not. Coming to how does depression develop? Who gets depression? Engane develop cheyyunnokkumbol there are a lot of factors, a lot of theories that has contributed to this. First thing we can look into is genetic factors. ഇപ്പോൾ ഫാമിലിയിൽ ആർക്കെങ്കിലും ഡിപ്രഷൻ ഉണ്ടോ ഓർ മൂഡ് ഡിസോർഡർ, ബൈപ്പോളർ ഡിസോർഡർ ഉണ്ടെന്ന് അറിയുവാണെങ്കിൽ ഇറ്റ്സ് ഓൾവേസ് there's a likelihood. There's no surety, but you are more susceptible to attaining a mood disorder. And ഒരാൾക്ക് ഫാമിലിയിൽ ഉണ്ടെന്ന് വിചാരിച്ച് ഉറപ്പായിട്ടും ഫ്യൂച്ചർ ജനറേഷൻ ഉണ്ടാവുന്നില്ല, പക്ഷെ there is a higher chance compared to somebody who has no family history. So genetics is always something we can factor in. ഇപ്പോൾ ഫാമിലിയിൽ ആർക്കെങ്കിലും ഉണ്ടെങ്കിൽ you can always get tested. If you are seeing symptoms, you can get tested to see if it's carried on or not. Another thing we can talk about how does depression develop is നമ്മുടെ surroundings. If somebody is already susceptible, if somebody has a family history of depression, their environment also plays a role. In the stressor, നമ്മുടെ environment, if any stressor comes, that increases the chance of us developing any mental illness, especially if there is a family history. So again, if you have a family history and you're always in a stressful environment, you're in a negative environment, a pessimistic environment, the chances are you might develop depression. So understanding how stress plays a role in combination with genetics is always something that we can look into. Another aspect of how depression can develop is parental, your environment, how you are brought up. If there is a physical abuse, there is a physical assault always at the individual. It can be emotional as well, it can be sexual as well. അങ്ങനത്തെ ഒരു പാറ്റേണിൽ പോയിക്കൊണ്ടിരിക്കുമ്പോൾ ഓട്ടോമാറ്റിക്കലി they're thinking about themselves, the world and others will be more of on a negative stance. They're thinking about themselves can degrade, no self-esteem, less self-competence, all of that can factor in. Also how they see others, other people in the world. എപ്പോഴും ഒരു ഡിഫെൻസീവ് അറ്റാക്കിംഗ് ആയിട്ടാണ് എല്ലാവരെയും കാണണമെങ്കിൽ then that also adds on to the fact that you can develop depression. And lastly is about the world. The hopeless situation where you feel, nothing ever works out for me. I will always fail. There's no way out of this. So that kind of thinking pattern also sort of contributes to how depression can develop in an individual. ഇനിയിപ്പോൾ നമ്മൾ തിങ്കിങ് പാറ്റേണിനെ പറ്റി പറയുമ്പോൾ because depression has to do a lot with our cognitions, other factors as well, but also with our cognitions. We can see depression പുറത്ത് ഇറങ്ങാൻ ബുദ്ധിമുട്ടാകുമ്പോൾ we'll see ഒരു black and white thinking. It's either this way or that way. There's no gray area in between. So even when we're facing problems, we need to be able to see there is a gray area. It is not only this way or that way. Another kind of thinking is personalization. എല്ലാം personally എടുക്കും. Anybody can say something normally, but then you thinking it's an attack on you and becoming defensive. All those kind of thinking patterns also